this video, I'm going to be talking about how they have changed the landscape of obesity and metabolic care, and also some questions that I hear often in the clinic. Is the medication dangerous? Does it cause cancer? Will it damage my pancreas? Is it cheating? What happens if I stop? I want to separate fear from facts and myths from medicine. First, a big picture safety perspective. Semaglutide has been studied in thousands of patients across diabetes trials, obesity trials, cardiovascular outcome trials, trials for kidney and liver disease. So these drugs are not new to the market. Some participants have now been followed for 4 to 5 years. No medication is risk-free, but semaglutide is one of the most extensively studied metabolic drugs we have ever had. The common side effects, the normal side effects and expected side effects, the most common ones are gastrointestinal, especially early on when you first start taking the medication, anytime you increase the dose. And the most common side effects that we see are nausea, fullness, constipation, bloating, indigestion, reflux, vomiting. Why do we see these side effects? These side effects happen because semaglutide slows the stomach emptying and acts on appetite centers in the brain, and your body needs time to adapt. To reassure, the side effects are mild to moderate and often tolerable. They usually improve with slow dose escalation or sometimes even staying at the lowest dose. The majority of patients who tolerate the first 8 to 12 weeks will do very well on these medications long term. This is why titration matters. Faster is not better. The goal is always slow titration and a slow, sustainable weight loss. Now, number one myth that I'm going to address is that Wegovy and Ozempic cause pancreatitis. This is one of the most persistent fears, and here's what the data shows. Large randomized trials and real-world studies have not shown an increased risk of pancreatitis compared to placebo or other diabetes medications. All diabetes medications put you at risk for pancreatitis. Yet it still remains rare and more strongly associated with gallstones in the context of alcohol use and or uncontrolled triglycerides. So those three situations are independent risk factors for pancreatitis. An important nuance in this is people with active or prior severe pancreatitis, we usually avoid this medication, not because we have history of proven harm, but just out of abundance of caution. Correlation is not causation, and that's important in this. The data does not support this fear. The number 2 myth: these drugs cause thyroid cancer. This concern comes from the rodent studies, the studies done on the rat, not human ones. In rats, extremely high doses of GLP drugs caused a specific type of thyroid tumor called the medullary thyroid carcinoma, hence the caution about thyroid cancer. However, we have not seen a single report, a case report, of humans getting this cancer on this medication. This signal has not been reproduced in humans. No increased rates have been seen in clinical trials or even in post-marketing surveillance. We clinicians keep a close eye on what our patients develop as a long-term complication. Also, we don't have the receptors on our thyroid glands that the rats have that predispose them to this particular type of cancer. That said, these medications are not prescribed for people with personal or family history of medullary thyroid cancer or a constellation of cancers called MEN2 syndrome. This comes as a precaution and not evidence of harm in the general population, and where patients are ready to accept the risk, we have used this medication safely in them as well. Myth number 3: Wegovy and Ozempic destroy muscle. Weight loss of any kind, whether it's by dietary changes or restriction of calories or surgery or medication, will involve some lean muscle mass loss. What matters is the proportion. Studies show that with semaglutide, the majority of weight loss is the fat mass, which is what we want. The lean mass loss is comparable or even lower than other weight loss methods. The solution is also there. You don't have to avoid the treatment. The solution to this problem is adequate protein intake, resistance training, and a clinician-guided nutrition plan, making sure that you're getting enough calories, enough protein, and enough fiber. These medications don't replace lifestyle changes. They enable them. Lifestyle changes are always the foundation of weight loss journey and the management of diabetes. That brings me to the next myth. Once you start, you'll never be able to stop. This is partly true, but often misunderstood, as we learned that obesity is a chronic relapsing disease. When treatment stops, the disease often returns. This is not addiction to the medication, this is biology. We don't shame people for staying on blood pressure medications, do we? Do we shame people on cholesterol medication, thyroid hormone replacement? Do we ever say or take away treatment from a cancer patient? Why do we have to do that for obesity? Semaglutide works the same way. It treats an underlying chronic disease. Some patients can taper and continue on a microdose. Some patients can transition to an oral medications, and some need long-term therapy. Again, individualized. You have to have a discussion with your physician who's supervising your journey closely. Individualization is key. Some rare but serious risks that I want everyone to be aware of. Number one risk that they have been associated with is gallbladder disease. Rapid weight loss by any method can increase risk of gallstones. And sometimes you already have gallstones and it can precipitate a gallbladder issue. This is not unique to semaglutide. It can happen with any weight loss method. Second is the severe GI intolerance. A very small percentage of patients cannot tolerate the medication. This is usually clear to us very early in the treatment. Next is gastroparesis-like symptoms. Gastroparesis is severe slowing of your gastrointestinal system. Semaglutide does slow gastric emptying. That's part of how it increases fullness. But there's a difference between physiological slowing, which is expected and reversible, and also manageable with fiber, with water, with exercise, versus true gastroparesis, which is a pathological nerve dysfunction, which might already be present in patients who have diabetes. True gastroparesis remains uncommon. And the most reported cases occur with rapid dose escalation and they improve with dose reduction or discontinuation. Again, individualized dosing and medical supervision are essential. Next, the fear of optic neuropathy. Now, the social media amplified this outlier and linked it to blindness. That is why separating myth and hype from science is very important. Progression of retinopathy was only seen in diabetics who already had baseline retinopathy. It was not seen in people who did not have retinopathy at baseline, and was also seen in people who were given the higher doses very quickly or had very quick control of their diabetes or improvement in their A1C numbers. Next, compounded semaglutide is not the same thing. This one is critical. The compounded versions are not FDA approved and use different salt forms. They might have dosing inconsistencies, and you have to see for the authenticity of the pharmacy you're getting it from. Next, cardiovascular safety. This is the reassuring part. One of the strongest arguments for semaglutide safety comes from cardiovascular trials. In people with obesity and heart disease, they saw that the heart attacks decreased, the number of strokes decreased, and cardiovascular deaths decreased. Very few medications can claim that. Lastly, this is not a cosmetic drug. This is a preventive cardiometabolic medicine. That brings me to the most dangerous myth of all. The most harmful myth isn't about cancer or side effects. It's this: if I just tried harder, I wouldn't need this. That belief keeps people untreated for years and sometimes decades, while disease progresses quietly. In closing, semaglutide doesn't replace effort. It just levels the biological playing field. Closing thoughts: every medication deserves scrutiny, and every medication has its place through data and not hype. Used thoughtfully, monitored appropriately, and combined with lifestyle changes, it is one of the safest and most effective tools we have today for metabolic diseases. If you've been scared, skeptical, or overwhelmed, you're not wrong to ask questions. Just make sure that answers come from science, not social media, and that you have a discussion with your physician and make an informed decision. Thank you.